Consider this number, more than 40% of South Africans surveyed say they wouldn't be comfortable with taking the COVID-19 vaccine. Writing in the Daily Maverick, public health care specialist Patience Mushamiri-Kuzviwanza says that with such a high level of mistrust, the message source is of high importance. The messenger, she goes on to say, needs to be seen as an individual who represents the voice of society and is accepted within the community. This is a very important issue in terms of messaging. Patience, good afternoon to you. Thanks very much for joining us. 47%, close to 50% of South Africans surveyed stated they wouldn't be comfortable with taking the vaccine. Why do you think, let's start the conversation here, why do you think that level of mistrust exists?
Good afternoon, and thank you for having me. I think in terms of the mistrust, mainly it's coming from not knowing, fear basically of this vaccine, not knowing what the contents of the vaccine are, and also fear of how quickly it was produced, knowing how longer clinical trials usually take. So people are a bit fearful, how did it happen so quickly? And also fear of side effects. There are lots of conspiracy theories that are going around what's in the vaccine and what side effects you might get. And then a little bit of a lack of transparency on the part of the government in terms of the whole rollout of the vaccine, who will get it first and how will you get it.
So you go on to write that in the face of the second wave, a solid and comprehensive communication strategy could be more important than actually acquiring the vaccine itself. Are you suggesting that there isn't a solid messaging strategy that exists right now?
So there is a messaging strategy that is in place, yes, but I think it's not as comprehensive as it could be. I think that it's not using the multiple communication channels that are there that needs to reach the different audiences around the society, and we need to use multiple communication strategies in unison if our aim is to achieve vaccine uptake in the community.
So multiple communication strategies. What would a better strategy entail then? What would that comprise?
So I think that this we want to have messaging that's targeting that's tailored rather for different target audiences. So by this now we're thinking of demographics, right? We have to think about different cultural and social groups. We have to think about different accesses to mobile connectivity, to internet usage, TV consumption. We have all of this data, and then we tailor the message for different target audiences through the channels that they have. So, for example, we have this data right now. We know how many people are viewing television as we speak, right? So let's make use of the tools that we have. Let's make use of drama, of storytelling, and also how we frame the message is very important. So instead of having very alarmist and very negative or messaging, like, for example, saying, if you don't take the vaccine, you will get sick, maybe something like, take the vaccine in order to protect your health and the health of your family. That's a different way of doing it.
All with a view, you suggest, of making communities feel engaged and empowered. What you're outlining, though, is a very big messaging task. We haven't left it too late, have we?
No, I mean, we can engage people, and the way we can do it is to validate their fears. So you have this, don't ignore the anti-vaccinators, basically. Listen to their fears. What are these fears? What are these concerns? And then address them. Don't ignore them. Don't act like they're not there. And also move away from this one way of communication where we have an address from the Department of Health or from the President's office, and that's it. There's no Q&A allowed, right? So if you allow journalists, for example, to ask questions when we have these family meetings, we call them family meetings because in that moment we've engaged the whole of South Africa, the whole family of South Africa is watching, and that's our opportunity to engage the community. Allow the journalists to be the voice of community, to air their concerns, answer them using a trusted and respected health professional who can give an encouraging, respectful and compassionate response to people and address people's fears. That way we gain their trust and hopefully increase vaccine uptake.
I sense there is a lot of work to be done. One hopes that government is engaging with this aspect of the project. Thank you very much indeed.